blood flow through the arteries and the dynamics with which blood flows through the arteries was discussed in the earlier video. There is resistance, pressure, and the radius of the vessel, viscosity of the blood, length of the vessel. All these factors affect blood flow in different ways in the arteries. Now, we just have to assume that the blood has moved through the arteries, in the arterioles, and is now at the capillary. Blood capillary, as you know, is the thinnest blood vessel. And here you just have the endothelial layer, and the basement membrane. You already know that capillaries are also called as exchange vessels. This is where exchange of substances between the capillaries and the tissue occur. Okay? Now, the flow of substances occurs in one of two ways. From the blood, substances escape into the interstitial fluid, and from there into the cells. And similarly, substances leave the cells and enter the interstitial fluid, and then eventually the blood vessel, blood capillary. And the thinness of the wall facilitates this type of movement. And you see another capillary here, and that is lymph capillary. All right, any excess fluid that's here in the interstitial space enters lymph capillary, which ultimately returns this fluid back into the vascular system. Now, the next point we need to address is exchange of substances occurs in what way? Is it diffusion? Is it osmosis? Is it active transport? Is it primary active transport? Is it secondary active transport? Well, those are all possible. Anytime water moves, it's mainly by osmosis. And then diffusion of substances, oxygen and CO2, for example, move through diffusion. Facilitated diffusion is possible. So there are all kinds of specific transport mechanisms that occur at the capillary. Now, although diffusion, osmosis, facilitated diffusion, etc., occur at the capillary, the more common means of exchange is bulk transport. Bulk transport. What is it? It is the movement of plasma from the capillary out into the interstitial space. Okay, so much plasma escapes into the interstitial space. And eventually substances from here would enter the tissue or the cells. Similarly, the fluid here, interstitial fluid, would be pushed into the capillary. So bulk transport is like so much fluid escapes out of the capillary or into the capillary. this fluid that escapes in either one of the ways would have nutrients or wastes or gases, etc., to be exchanged between these compartments. All right. Now, the next thing we want to talk about is the forces that are associated in the bulk transport. Okay, bulk transport is the movement of so much fluid in or out of the capillaries. In how is it possible is where we say there are a variety of forces involved, and these forces determine the direction in which fluids move. Well, the most familiar one at this point is the blood pressure. The blood pressure in the capillary ranges from about 35 millimeter mercury to 18 millimeter mercury. At the arterial end, it would be a greater blood pressure compared to the venular end. All right, so this is a typical range. So the textbooks you may refer to may have slightly different numbers, so please keep that in mind. All right, so blood pressure in a normal situation would be greatest in the arterial end, least in the venular end of the capillary. Now, this is all within the capillary, correct? Now let's talk about another pressure that we have to encounter. That's osmotic pressure. Osmotic pressure is the force with which water moves in the direction of higher solute concentration. Let's think about it like this. Blood has plasma proteins and blood cells. So the solute concentration within the blood is greater than the solute concentration in the interstitial fluid. All right, when you're looking at two compartments, blood would be more concentrated than the interstitial fluid. So water from the interstitial fluid would move towards blood capillary with a certain force. And this force is called osmotic pressure or oncotic pressure. And that's typically around 25 millimeter mercury. So these are the two pressures that we need to consider mainly. Blood pressure is within the capillary. Osmotic pressure is the pressure that you're thinking about from the interstitial fluid towards blood. So this is the opposing force. Okay, this is the resistance that the fluid has to face in its direction of movement. Please note that we could take into account hydrostatic pressure in the interstitial space or osmotic pressure between the from the blood towards interstitial fluid. Okay, this may be confusing for you. Is there a hydrostatic pressure in the interstitial space that you need to keep in mind? Yes, there is some pressure, hydrostatic pressure. It's not actually blood pressure because there is no blood in the interstitial space, but whatever fluid that surrounds the blood vessel, that's the capillary, would be the hydrostatic pressure, fluid pressure. Okay. So just to avoid any confusion, I'm going to say it's negligible. There may be a pressure of 1 millimeter or 2 millimeters. When we think about 35 millimeter or 18 millimeter, this small pressure is negligible. And just to avoid confusion, we will not include the hydrostatic pressure in the interstitial space, not including any other hydrostatic pressure. Similarly, what is that osmotic pressure that would draw any water from the blood towards interstitial space? Negligible. Interstitial fluid doesn't have many solutes compared to the blood, therefore the oncotic pressure or osmotic pressure that you would expect is minimum. Okay, so ruling out these additional numbers makes our job here easy to understand capillary exchange. Okay, so we have the blood pressure in the capillary, we have the osmotic pressure outside of the capillary. Now think about it like this. I'm going to take you to the illustration here. You have the arterial end, you have the venular end, you have 35 millimeter mercury here, and 25 millimeter mercury in the interstitial space. The difference is going to be 10 millimeter mercury, and that's what you call as net filtration pressure. So at the arterial end, net filtration pressure is plus 10 millimeter mercury. It's a positive number. Somewhere around midway is where the pressure, the blood pressure in the capillary would be 25 millimeter mercury, and the osmotic pressure doesn't change much. So let's assume that it's still 25 millimeter mercury. So if you have 25 millimeter mercury blood pressure, 25 millimeter mercury osmotic pressure, the net filtration pressure is 0. All right. Now at the venular end, you're looking at 18 millimeter mercury pressure within the capillary, whereas the osmotic pressure tends to be constant, and that is 25 millimeter mercury. So the difference between 18 and 25 would be a negative number, it's -7. So now we actually talk about bulk transport. Whenever the pressure is greater within the capillary than the opposing force, the oncotic pressure, fluid escapes from the capillary to the interstitial space. That's what you call as filtration. Fluid leaving the capillary to the interstitial space is filtration. When the net filtration pressure is 0, no net movement. There's no movement of fluid either way. Then when the pressure is negative within the capillary, fluid from the interstitial space moves into the capillary. Okay? So here, nutrients and gases that are in the plasma are taken out of the capillary. And then here, the wastes that are generated by the cells are brought back to the capillary in this fashion. The color red shows oxygen leaves, color blue shows that CO2 enters the capillary. So this is simplified version of capillary exchange. We can use this mechanism or the setup of various pressures in the fluid shift. We can talk about what happens if there is greater hydrostatic pressure than normal. Assume that there is a patient with untreated hypertension. Then the blood pressure is probably going to be greater than 35 millimeter mercury at the arterial end. what would happen then? More fluid escapes in the form of filtration. The difference between osmotic pressure and blood pressure would become greater, so more fluid escapes. And the pressure may be higher than 18, but it may be drawing less interstitial fluid back than in the normal situation. Okay, so in any case, this is safe to understand that there is more filtration than normal. Agree? Now, another situation could be liver disease, such as cirrhosis, where plasma proteins are not made, that would affect osmotic pressure. It may not be 25 millimeter mercury, but it may be 20 millimeter mercury, because there is less plasma protein, so the force with which water moves into the capillary would be reduced. So when you have less opposing force, there is more filtration. So those are some mechanisms. Either situation could cause edema. Edema, the buildup of fluid outside of the capillary. So one thing that you also notice here is the amount of fluid filtered, because it's plus 10, is expected to be greater than the amount of fluid that enters the capillary. This is -7. It's not -10. So if these numbers were equal, plus 10 and -10, you know that the amount that escapes, 100% of that is returned. Because this is less than what was filtered, it's safe to assume that some of the fluid has not made its way back to the capillary. Some of it remains in the interstitial space. All right, so about 15-20% of fluid that gets filtered stays back in the interstitial space. Now the question is it possible to lose 15-20% of blood volume due to capillary exchange? That's a lot of fluid that's lost. So each trip the blood makes through the body systems, if you continue to lose 15-20% out of 5-6 liters of blood, you will end up having 4 to 5 liters of blood and 3 to 4 liters of blood, and eventually that would affect blood volume severely. Well, there is a mechanism by which the fluid is brought back to the vascular system. This is where we can go back to our illustration here. You see the lymph capillary? Lymph capillary follows blood capillary almost in every part of the body, except in the brain. Now, what happens is excess fluid that remains outside of the blood capillary eventually makes its way into the lymph capillary. And this lymph capillary eventually becomes lymphatic vein and major lymphatic veins, ultimately releasing this fluid into the vascular system. So that's how the amount of fluid that's filtered is balanced out to the amount of fluid that's left behind when so much fluid returns to the capillary. One other interesting fact here for you to know is the fluid that escapes from the blood capillary is plasma. As soon as it enters the interstitial space, it gets a new name, interstitial fluid. As soon as interstitial fluid enters lymph capillary, the name changes to lymph. So it's more or less the same fluid being described in different ways in different places. All right? Think about one more thing. What if lymph capillaries were damaged? Simple. Excess fluid is not returned back to vascular system. It accumulates in the interstitial space. That leads to edema. All right. One other cause of edema would be damage to lymph capillaries. Okay. Surgery causing injury to local lymph capillaries may be the cause of edema in some patients. Okay, so with this detail, we will make our journey. We already talked about lymph capillaries. We'll make our journey to talk about blood flow within the veins. Well, we know that most of the blood is found in the veins. About 65% of the blood is held in the veins. What's the reason? Veins have thin walls, large lumen, distension is easy here, they easily get distended. So another factor is blood pressure is low. Low blood pressure, correct? It's the least blood pressure. We talked about blood pressures in different vessels. Arteries have the highest blood pressure. Then it declines as arteries become arterioles, and then capillaries, and then as they become veins, the pressure continues to drop. So lower pressure here, thin wall, large lumen, just an ideal situation for blood to accumulate. All right, so how does the blood flow here then? Well, we have some mechanisms to help move blood through the veins. Veins in the upper part of the body above the heart easily won't have much problem because of one fact, that is gravity. Gravity pulls blood to move in the direction of the heart. Okay? Now, when you think about veins in the body parts below the heart, that's where situation can be difficult to return blood back to the heart from these veins. We have some helpers. One of them is skeletal muscles, and the other one is the action of breathing. And then, of course, sympathetic action of vasoconstriction that makes the veins constrict and move blood towards the heart in that manner. Okay, so let's talk about skeletal muscle pump. So if you're thinking about the veins tucked between two muscles in your legs, like shown here, okay, and note here, this vein has valves, okay, veins in the lower parts of the body typically are equipped with valves just to make sure that the blood doesn't pool in the lower parts of the body. This is how you compartmentalize blood in these veins. So here the muscles are relaxed. Okay? So valves are closed, blood is in this compartment, and this valve is closed, this valve is closed. That's how it is. And now you're talking about walking, some type of movement. That's how you show muscle contraction here. What happens is that squeezes the vein that's tucked between these muscle fibers that forces the valve to open, and blood gets pushed to the next compartment. All right, so this is how blood gets pushed upwards in the direction of the heart. Quite neat, correct? The way respiration helps is typically between the thoracic cavity and the abdominopelvic cavity. Okay, each time you inhale, the diaphragm moves into the abdominal cavity. When the diaphragm sits in the abdominal cavity, the space within the abdominal cavity is reduced. The space within the thoracic cavity is expanded. There is a nice relationship between volume and pressure. Okay, they're inversely related. If you have less volume, there is higher pressure, and vice versa. So think about it now. You inhale, diaphragm dips into the abdominal cavity, reducing the space, reducing the volume. Pressure in the abdominal cavity becomes greater than in the thoracic cavity. Thoracic cavity, on the other hand, is expanded. Therefore, the pressure in here would have dropped. So when you have lower pressure in the thoracic cavity, higher pressure in the abdominal cavity, blood moves from the higher pressure in the abdominal cavity to lower pressure in the thoracic cavity. So within the legs, you use the skeletal muscles to move blood. You called it a skeletal muscle pump. This is not really a pump, it's just the natural movement. And then the respiratory function helps move blood from the abdominal cavity into thoracic cavity where the heart is situated. So this is how we would return blood back to the heart from the veins in the lower parts of the body. Okay. So this should remind us that if we are not actively moving, the return of blood from the veins, venous return, may be less than normal compared to a time when you're actively moving around or exercising, etc. So those are better times for venous return than a sluggish time when you're lying in a bed, for example. All right, so this is where we have understood blood flow in the artery, in the capillary, and in the veins. All right, this is where we stop. Thank you very much.